Okay, thank you very much. I'm very happy to be here to present my work on Google, COVID, and fertility rates. This is joint work with some of my colleagues here at the Max Planck Institute, as well as Chen, who is a graduate student at Fordham University. There we go. Okay, so I actually really appreciate the fact that Lyman went ahead of me because he did a really good job in kind of setting up the different theoretical frameworks in which we can think about the effect of COVID-19 on births, which means I don't have to spend as much time on it. So we know that there is this kind of buzz in the media about how much, if or how much there'll be this baby boom as a result of COVID-19. I've even seen, people going so far as to say there's going to be an entire cohort of people born, and we're going to come up with interesting names like quarantines or coronials, these English puns, because there's going to be so many births. But most of these people, I don't think, are academics or demographers. As Lyman talked about, mostly what we see when there's some sort of crisis, especially a mortality crisis, there's a negative effect on fertility. Also, I'm happy that Tomas is chairing this session because he's kind of written the review on the cyclicality of births. So he can, attest to the fact that when there's these economic downturns, there generally tends to be fertility downturns as well. However, the issue is that these births haven't happened yet. We don't exactly know the magnitude. We probably know the direction, but we probably don't know the magnitude of exactly what's going to happen yet because these births have yet to occur. So what I'm doing in this paper is I'm kind of taking a page from work that's already been done, which has used Google data to try to predict stuff, right? You can predict, there's been a lot of work on Google predicting public health, such as Google flu, dengue, mental health or suicide. Other measures of well-being have all been kind of predicted using these Google searches from Google Trends. There's also been some prediction papers written on other demographic outcomes like migration, sexual behavior, and mortality. And there's actually one paper that while I was writing this project, I came across by Bellari et al. In 2016, which actually tried to use a few, excuse me, a few words to use of these Google trends to predict fertility outcomes as well. So the intuition behind what I'm trying to do here is fairly simple. If I was trying to explain it to a non-academic, I would say, if all of a sudden you observe that searches for morning sickness or missed period or am I pregnant rose, you might start to think that births 6 to 9 months later might be higher than normal. So we're going to try to use these Google search terms that have to do with pregnancy and fertility intentions in order to try to figure out how, first off, whether these search terms are associated with fertility, and if they're associated with fertility, if we can use those associations to predict fertility as a result of the COVID-19 pandemic. So to do this, we have to do three things. So as I mentioned, we first have to establish that these associations between specific pregnancy-related words and the timing of births are strong, relevant, causal, and predictive. After we establish that these associations exist, we then have to cross-validate these associations with out-of-sample tests, because it could be the case that we're just picking up spurious correlations or something that has to do with seasonality. So we need to test out of sample to make sure that the words that we've chosen are actually predictive. And then once we've done that, we run our simple model using these associations for these specific words to forecast births into the future. So we have two main sources of data. First off, the two main sources are data from Google on searches and data on births. So we use data from Google Trends, which is a really interesting and cool website. You can go on there and search any word that you want for any time frames up until 2004, or sorry, after 2004, for any region of the world. And it'll tell you an index of how that search behavior changed during that period. We also, for our birth data, we use data from the National Center for Health Statistics, which reports births by state per month from January 2004 to December 2018. And we do a heterogeneity analysis later on in the paper, and in order to do that, we change the dependent variable from being total births to total births among a certain subgroup of the population. So we can say total birth to women who have a bachelor's degree or higher, for example. Okay, so the first thing we have to do is we have to choose which pregnancy related keywords we want to test. Now, we don't want to do a strictly data mining exercise because that is, academically unethical. Just to, see which words are related just by random chance and then using those words and saying, oh my gosh, look, these words are related. So what we did to start is we brainstormed 40 different keywords across 7 different categories. And it wasn't just the 3 people who were on the paper. We kind of crowdsourced this to a large group of people. We probably talked to 20 other researchers, social scientists, all of them women who were experts in different aspects of fertility. For example, there were people who were like Catherine Grace from University of Minnesota, who's an expert on, fetal loss and pregnancy termination, and others. So the 7 categories that we chose were, first, we needed a control group because it could be the fact that during the pandemic, searches for all words rose, not just for pregnancy words. So we created this composite control, which I won't go over, but I can talk about it later in a breakout room if you like. We had a category for unplanned pregnancies. And for this, we had words such as emergency contraception, the morning after pill, online dating, and others. We had a group for pregnancy intentions. These were mostly pregnancy tests. Pregnancy symptoms, pregnancy termination, which covers both miscarriage, but also induced abortion. And then words about the economic situation, like unemployment, and then other words that were related to pregnancy, but didn't fit in any of these categories per se. So in order to test whether these words are predicted or associated with births, and at what time frames, we need some sort of economic model, or sorry, not economic, but statistical model. So we ran this regression equation, which looks more complicated than it actually is. So the outcome variable here is the raw number, it's actually the log of the raw number of births. And we regress that on a whole set of keyword search volumes, which here is represented by I. So not only do we regress over an entire set of words W, but also at different time frames. So for example, for the word clear blue, which is the name of a commonly used pregnancy test in the US, we will include in our model the searches for clear blue 7 months ago, 8 months ago, 9 months ago, 10 months ago, over this whole time frame. And then we will do that for each of our words. That's the double summation that you see. And from that, we get these predicted betas. Now, so fertility is seasonal, and a lot of the searches for these words are seasonal. So what we don't want to do is have the seasonality affect our prediction. We want to find the prediction of kind of excess searches in words above and beyond seasonality. And that could vary at the state level. So we have alpha here is a state month fixed effect, which gets rid of month-specific seasonality. The U here stands just for lags in the unemployment rate. So we control directly for unemployment in our model so that we're not getting just correlations between words and unemployment. And then we have we have to control for time trends by state. So here we control for a quadratic in time as well. So these are the results. I'm going to go through a few words quickly just to kind of give you an idea of what these associations look like. So this again is the word clear blue, which is one of our most predictive words. Clear blue again is a pregnancy test. So as you can see, there is an increase. The solid line here is our coefficient for each month. And we can see when there's excess searches for clear blue, 9 to 6 months when there's a high level of searches for clear blue, we see an elevated level of births 9 to 6 months later, with that peaking at 8 months later, which is precisely the time when most women who think they may be pregnant may be engaging in pregnancy tests. Now, just to explain this figure a little bit, the solid line is the coefficient value. The dashed, the line, not with small dots, but with the dashes, that's the normal 95% confidence interval that you would get. The dotted lines are standard errors controlling for multiple hypothesis testing. So I'm an economist, and in that field, they're becoming more and more worried about, data mining and running a regression where you test 400 hypotheses and having, a 5% of those being positive, even if there's no real effect. So they do these corrections for multiple hypothesis testing. Generally, what that means is they have to be significant. In the case of this paper, where I'm testing about 400 different hypotheses, they have to be significant at about the 0.1% level. So you can think of that almost as like a 0.1% confidence interval. So these are extremely significant effects that I'm finding for clear blue. Pregnancy, we find that there's there's a strong positive association at month 7, which is when, a lot of people who are newly pregnant are probably searching on the internet for, information about that pregnancy. For birth control, we see that before 9 months, in months 10, 11, and 12, we see that if there is increased searches for birth control, there's actually less births later on, which makes sense. If people are searching for birth control, maybe they get birth control, and then there's less births afterwards. We
Sorry,
also
Josh, 2 minutes only.
Oh, 2 minutes. Okay, very good. I'm going to skip the rest of these. So then we do a bunch of cross-validation. I won't go into details here because it's fairly technical and long to describe, but we basically want to test whether these associations are predictive out of sample. So we cut our sample into 2, use 1/2 of the sample to predict the data in the other half. And if it's predictive, it passes, and we use that in our final model for our final keyword set. So the third step is we use these estimated betas to predict what's going to happen in the future. And I'm going to skip what's actually happened with Google searches, except to show you this figure, which shows you that searches for unemployment absolutely skyrocketed after the pandemic lockdowns occurred in the United States. So the second vertical line there is the timing of the first state lockdowns. And this is an index where 100 is equal to kind of the normal rate of searches. And so we can see that searches for unemployment skyrocketed to almost 20 times their normal level. If you look at searches for other words, there was a collapse, but they're definitely not as strong as the collapse for unemployment. And searches for other words like clear blue actually didn't change much at all as a result of the pandemic. So these are our predictions here. And what we see from this figure is that we predict that there's going to be about a 15% decline in overall fertility up until February 2021 as a result of this prediction model. That's what this data is telling us should happen. We've run later. This is a little bit old of a figure. We've now pushed this out an extra 2 or 3 months, and we see evidence of a bit of a rebound in fertility. It doesn't go all the way back to normal, but it looks like it does start to go back to normal. So that, to me, is kind of like an early indication that perhaps this is a delay, since we see a rebound after a few months. But that depends on a lot of things. in particular, how the pandemic is going to evolve over the third wave now in the United States, as in addition to the economic effects that it may have. So is this believable? I think it is, especially in the context of what's happened in other pandemics and economic crises in the past. So a 15% reduction is almost the exact same amount that happened right after the Great Depression and the Spanish flu epidemic. And it's only 50% larger than what happened after the financial crisis. So I tend to think that these effects that we're predicting are reasonable, but large. So I will stop there because I'm guessing I'm out of time. But thank you very much for having me, and I look forward to the comments after this.